My name is Rashmi Halker Singh. I'm the Deputy Editor of Headache. I am delighted today to be joined by Megan Lacritz, an author of a recent publication entitled The Role of Prodromal Symptoms in Predicting Headache Onset, a longitudinal electronic momentary assessment study. Welcome, Megan. I am so excited to be speaking with you about this work.
So nice to meet you. Thank you for having me.
First of all, can you tell me what is the central question that motivated you and your colleagues to even do the study in the first place? And also, what is this EMA or ecological momentary assessment diary design that you all chose to implement with the study as well?
So, new migraine treatment suggests that treating during the prodrome may be really helpful. The problem is that a lot of people can't tell when they're actually in that prodrome phase, the period right before head pain. And so they won't have the opportunity to treat during that frame if they're not sure they're in that phase of migraine. And so we really wanted to understand what people with migraine are noticing and if they're actually in the prodrome. And if they are, what symptoms are they using to predict that?
That's such a great, insightful comment because, as I'm a clinician, I take care of people who live with migraine every single day. And this comes up in conversations with my patients. I talk to them about prodromal symptoms, and they can be so subtle. Patients do not recognize. I'm also somebody who lives with migraine, and sometimes I myself can't recognize my prodromal symptoms as well. I think you're spot on with that, and that's a great reason to do this work. So, what is this EMA? Ecological momentary assessment. This is the first time I've come across that term as well. So can you explain that?
Yes. So this is a great new innovative technique that has really come about with the increase in technology and digital smartphone apps, and something that my lab at graduate school is doing a lot of work in. And so what we can do is have individuals be a part of this study, and they download a smartphone app onto their phone, and then they get a ping to complete basically a survey or a series of different questionnaires and tests multiple times a day. In our specific study, this was 3 times a day, every day for 3 months. And so by doing that, we're able to track those daily symptoms. We don't have to have people thinking back over the past month or the past week, how many migraines, what symptoms were they experiencing? And then it also allows us to really look within the different phases of migraine because we have this rich data from every day over multiple months.
I think that's genius because, as you mentioned, with prodrome, these are the symptoms that happen even before the pain begins. Many people don't even recognize their prodromal symptoms. And if we ask them to pay attention to their prodrome symptoms, we might not be capturing the data, or you might not be capturing the data that you're truly looking for. So instead, if you're pinging them, as you say, with your app and asking them symptoms in that moment, that's a really genius way to, I think, identify some important findings. Speaking of, I thought, what you did find was very helpful to someone like me, a clinician that takes care of patients who live with migraine. Some of the high level findings that you spoke about were things like blurred vision and other vision disturbances like photophobias and also phonophobia as being prodromal symptoms. Can you speak to that a little bit?
Yes. So interestingly, the symptoms that were reported most by individuals were things like fatigue, stiff neck, and thirst. But the symptoms that we found that were most predictive of actually getting a headache within the next 24 hours were the symptoms that you were just mentioning. So sensitivity to light, sensitivity to sound, blurred vision, and nausea. So some of those kind of cardinal migraine symptoms that we think about were the most predictive, even though they may not be the most commonly reported symptoms experienced.
Did this surprise any of you or any of your colleagues on this work at all? Was this unexpected in any way?
I think that in this study, we specifically were looking at 11 prodromal symptoms, and those symptoms were chosen because of their frequency throughout the literature and other studies that have showed that people are reporting these during the prodrome. So we did expect some like these symptoms to come back showing hopefully some clinical value, but it was surprising to see the split in what is reported most of the time or by the majority of participants versus the ones that are actually seem to be more clinically useful in terms of their potential predictive value. But we did, make sense of the fact that many of those symptoms are ones that people readily know are involved with migraine. So they may be a little bit more in tune to those.
I think that makes sense. What I found to be most interesting about your study was what I think you called the anticipation finding.
Hmm.
Many people will talk about the fact that they anticipate that they might have a migraine attack that day for various reasons, right? Like they might talk about different weather conditions or they might talk about for different reasons. But what you found was that these prodromal symptoms were more predictive of headache onset when people were not anticipating having a
Hmm.
migraine attack. I think that's so intriguing. How do you interpret this? Can you explain this a little bit to us?
Yes, that was one of the most surprising findings of this study is that the anticipation actually weakened the relationship. So some of the ways that we were conceptualizing that is one, that it's possible when somebody starts to think they might be getting a headache or a migraine for a variety of different reasons, they may start to enact those behavioral changes like resting, staying away from light and sound, taking medications. And so then they may start to do that. And then when the diary then asks them at a later point, did you get a headache? Maybe they didn't actually get the headache because they started to enact these changes beforehand. And we did not capture if they started to enact their own behavioral strategies. We also were thinking that another explanation could be that when somebody has that worry and anticipation of a migraine, it may lead to this increased attention of their body sensations. So then, in turn, they may actually report more sensations and symptoms that may not actually be related to the prodrome or migraine. It's more that you're overanalyzing your bodily sensations and then reporting more symptoms.
I think those are really valid points. So, as I mentioned, I take care of a lot of patients who live with migraine. What are things that you think I should be taking from this work with the next patient I see who has migraine, and I want to incorporate this into my
Mm-hmm.
prodrome, my conversation about prodrome?
Yeah. So what we saw is that it's not that these prodromal symptoms perfectly predict getting a migraine, but they can be contributing factors to think about when making a clinical decision of should you be starting early intervention or starting early treatments. And so it's not that it should be viewed as a standalone factor to start an early intervention, but it definitely can contribute to what maybe you may start to enact for yourself, whether that be a medication, a behavioral intervention. And so we want to really raise awareness to the importance of trying to figure out what are your prodromal symptoms, what are you noticing in yourself, do you end up getting a migraine from that so that you can start to enact that early treatment.
I think that's really important. So, you shared with me that you're finishing up your PhD at the moment with
Mm-hmm.
future plans to go into,
Yes.
you said, is it health psychology, clinical psychology?
Health psychology and neuropsychology.
And neuropsychology. You'll be joining our headache medicine field, hopefully. I'm so excited about that. Um, I think this study has added so much to our understanding about migraine and prodrome. What's next? What do you think is coming up next for you as you continue this work?
Mm-hmm. Some of the things that I'm going to be kind of looking into next are focusing in a little bit more on the cognitive aspects that people are experiencing with migraine, and specifically looking at are there differences between individuals with migraine and their reported cognitive symptoms? And does that differ between people with migraine versus people with other health conditions to try to figure out what are these cognitive symptoms that individuals with migraine are experiencing?
Well, I can't wait to read what you find. Thank you so
Thank
much
you.
for your conversation today. And I look forward to seeing you in person really soon.
Thank you. Thank you, you too.